Okay, so I hope so everyone is doing well. This is Dr. Shahriar, and we're going to start, I think, the overview of surgery. That's the classes. Let's say how much I can give the overview of the first class, and if possible I'll give more overviews. So let's get into the slide. So this is the slide number 1 for the surgery class, as you can see. So yeah, so this is the slide which probably you guys are looking for. So surgery, the general surgery class 1. First of all, the disclaimer said, during your surgery class, a lot of things you need to write actually, because if you try to target a general book like Bailey and Love, like this Norman Browse, and a lot of other books are there, but it's quite scattered first of all. So that's the reason you need to follow this slide, which I'll be telling during the classes actually. All right, now the book references is still, we need to give you some of the book references. As you can see, the Kaplan, John Murtagh, those things I'll be talking from John Murtagh, but normally John Murtagh does not have that kind of surgery. But the limited things that's out there, you also need to see that. Oxford Handbook of Surgery, AMC Surgery. We also have a surgery book in our office. So also we provide the soft copy of that one. If I get time, I'll try to show you that one at the end of this overview. All right, so here we go. That's the thing. So initially I'll be starting the classes with the ethical thing, so after that ethical thing regarding the surgery, we will be getting to more ethics related to surgery. Third, some of the surgery and contraceptive, some of the in relation, those things are there. Apart from these, we'll be getting into the pure surgical topic, means the post or pre-operative, the assessment, so all those things we'll be discussing. Next, more things about the pre-operative assessment in terms of the respiratory. You will also find about the post-operative management, and this is so important. Post-operative management, this is a 5-star topic. I'll be teaching this thing in the class, so a lot of things will in discussion it will come, and for that one we will use this particular slide. All right, so now one thing, since you guys will be preparing with this the overview, the days are important for the post-operative cases, features are important, investigations are important, and what to do next, the first line of the management, those particular things are important. Now after that, one of the things that already I have talked is the warfarin, heparin, and the DVT thing, but I'll be giving you another overview of that one. Now a few things, MC surgery book I'll be talking about later. So same thing, say if a person is getting anticoagulant, so what should be the preoperative measurement? Should I stop the anticoagulant? So those are the particular thing we will be also discussing in the class. So so how to apply CHAT score, so this is also important, how to apply CHATs. Some of the emergency surgery, so if someone is already having anticoagulant or antiplatelet, okay, so if emergency surgery, elective surgery, those particular thing we will be discussing. Now apart from that, you also need to see John Murtagh 1440 for the 6th edition user, 7th edition user, I think 1425, that's the page number. So this particular thing we already discussed in pediatrics, but I'll again give you an overview, and it can be a revision kind of thing, but that's a surgical topic just to add. Now the fluid thing will come, so a lot of things will come in fluids, then there will be more things about fluid which will come up, and still more fluids. Those have your MC bestseller edition, you can also check the fluid thing from there. Apart from that, yes, more fluid thing and scenario, lot of type of scenario that often comes in the MC exam, so I'll be talking about those scenario actually. So apart from that, yeah, some of the special slides definitely is out there. Yeah, so yes, diabetes mellitus is a higher topic which is already taught in the medicine, but in a patient with a surgery, say elective surgery, how do you want to adjust? So that particular thing will be discussed. It's a very common thing like post-operative pain management. So which one is first line, which one is second line? If you have allergy to some medication, then what to do? If you have renal problem, then what to do? So those particular things we will be discussing in this slide actually. Now after that there'll be the thyroid, parathyroid, some the surgical thing that will come, and also hypokalemia is a very important thing. So mild, moderate, severe will be discussing, tetany will be discussing. It's a super high topic, and with hypokalemia there's 2 or 3 types of question comes. That one I will be discussing actually. Say hypocalcemia, at the same time if there is severe anemia, if there is severe bleeding. So a lot of things if mixed, which one you need to treat first. So that kind of question often tested. Okay, so few things are in related to emergency. Our class number 3 for the surgery that has separate classes and overview about the bowel, like in after surgery when the bowel sound appears. So those kind of few topic I'll be discussing at the same time. And yes, few thing about the own infection things will come up. This is some so slightly as electrolytes. So again, a 5-star topic like electrolyte, especially the sodium, like calcium, even the potassium. Potassium we discussed in very details in cardiology, but we will again give you overview of the potassium thing, like hypocalcemia, so the potassium increase, calcium decrease, and also hyponatremia. So all of these things are so important actually, and you need to know the normal ranges at the same time. Okay, so few of the things you can see will come up as a slide. As you can see, we'll be discussing this thing. Hyperkalemia, like so important, like number 1 5-star topic actually. And a dialysis patient, hyperkalemia, different cases, hyperkalemia ECG changes. So those in variant way the question can be tested. Okay, so you watch out in the class. Okay, so and some of the thing which is related to John Murtagh, what is written there, we'll be seeing the management, we'll be seeing the mnemonic, as you can see, and also some of the question will be coming up. As you can see, it's also newly added, like the post-op management. So this is so important, like the post-operative, some of the oliguria. So these are some of the things which is extremely important. All right. So apart from that one, as you can see, post-op oliguria, this is one of the things which you definitely need to remember actually. Sorry about the sound, someone is someone is calling. So even during class time I switch off my mobile, but still I think through the laptop few of the things are coming. Sorry, please ignore that one. All right, so post-op oliguria we'll be discussing. Yeah, so this is the thing, the catheter. This is one of the very hot topic, guys, like the catheter induced and the other thing induced. Let the call I think stop first. Yeah, then I'll proceed actually. All right. Yeah, I think stop. So it's a good thing. So post-op oliguria, so with catheter, without catheter, as you can see, this is so important. All right, so post-op oliguria, another post-op oliguria. So there's 13 level questions out there for post-op oliguria, which we'll be discussing in the main class. So this is the overview class. Usually before every class we give the overview, like what to study, what not to study, and we supply some materials for more study. Another new question, post-renal transplant. We always update, why SMA is very popular in terms like we have reached almost I think 1,000 students. So this is a good thing. So that's I'm very happy today. So so post-renal transplant is another thing, very important topic. So cadaveric kidney and the living donor. So and what is the diagnosis? So they'll give you a scenario and he will have to get the question. So I'll be explaining more in the main class. All right, in this one C, as you can see, A for the live kidney and the C is for the donor kidney, cadaveric kidney. C for the cadaveric and A for the live kidney. I'll be explaining in the main class. All right. One of the things which I also discussed in the pediatrics, but again I'll give you overview, pediatric surgery. Pediatric surgery. So that's also important. After that, some of the general things, these are not 5-star, these are like 2-star topic, like shock. I'll say 3-star because the cardiogenic shock we have seen in coming, hypovolemic shock we have seen coming, septic shock we also have seen in different exam, and the first line of management is so important. Post-op seizure is another so super high yield topic, it's important. And diabetes mellitus, and the post-op cases, especially diabetic ketoacidosis, which is related to type 1 diabetes, how to manage, which one is first line, which one is second line, which one is third line. All right, also in relation with some scenario, and diabetes separately is already taught in a lecture, so you definitely need to overview that one before the surgery. All right, so DVT is another thing which we are going to discuss. What's the clinical scenario, what is the first line of investigation, what is the next step of investigation. DVT with 2 scenario that often comes, one that is with the kidney, and the second one comes often with the pregnancy. So in which case which investigation to follow. So this is one of the very, very important thing. This is just maybe a 1-star topic, like primary, reactionary, secondary. Few things sometimes we add because there are some candidate, they always came up, doctor, you didn't teach the hemorrhage. Okay, so but in terms of AMC, it does not test it. All right, and some of the things which is related to anesthesia, I'll be talking about that one. Which 1-2 question is exactly related to anesthesia, I'll be talking. All right, needle stick injury, so important nowadays. Needle stick injury, often a popular question from the last one. Someone is traveling in a public transport and also get having a injury, needle stick injury, like how much probability of having HIV or something. There's a question like that will be showing in the recall class. So remember one thing, these are our theory class. We also have recall class. Apart from every Sunday we take theory class, every Thursday the same class just turned into the recall. So this is the best way of taking preparation. We also give you question bank, you don't need to buy any question bank. Secondly, there will be a mock test every week. A surgery finished, again surgery, every single topic that is finishing, respiratory finish, against exam. So that's how we proceed. That's the reason we have extremely high passing rate. Okay, so is one of the question. Few, even though I put recall here, but we have separate recall class. Few of the things I brought just to make things interesting. All right, so just few things. Yes, so high yield thing, lot of recalls we'll do on this one. Tetanus, like when TT and when TIG, when both. So this is, if you understand the tetanus then. All right, so some of the cases, but more cases in the main class. One of the thing will be related to peripheral vascular disease. So one of the question nowadays is coming. So why not smoking in this case, and why supervised exercise? I'll be explaining. This is a very recent question. All right, so some of the vaccination and things, I think it's related to the tetanus one. I think that's all for the surgical cases. I think that for the first class we have a second surgery class. We'll again come up with another overview. For the second surgery class we have 3 classes for general surgery, then 1 class for eye, 1 class for ENT, and 1 class for orthopedics. So this is your mentor, Dr. Shahriar, and see you with another overview topic. Have a great day.